Part 2. The system. It is not a secret that the NHS is not doing well right now. I personally don't like the word crisis, as it suggests that it's temporary. After being in the trenches for years now, I can tell you there is nothing temporary about the NHS's problems, and they are only going to get worse. Every paramedic must operate within what we will call the system. In the UK, it will obviously include our beloved NHS with all of its rules and regulations, as well as associated entities like the Health and Care Professions Council and the Joint Royal College Ambulance Liaison Committee. If you look at official NHS websites, social media posts, and talking heads, you would think we are all about efficiency and patient outcomes. Unfortunately, all we really care about is how to do our job without getting in trouble. Therefore, to redirect any potential liability from any one person, the system has created multiple rules and guidelines, outsourcing the decision-making process. The guidelines, however, at least the ambulance ones, are written for the lowest common denominator with an intent for no patient to slip through the net, regardless of how many false positives it may create in the process. Everyone, both individuals and entities within the system, is so scared of litigation that no one wants to take responsibility for anything or make decisions independently. After all, it is far more difficult to take nice guidelines to court than a doctor who decides something based on their knowledge and judgment. That means clinicians would rather follow the script and make a decision that doesn't get them in trouble, even at the expense of everyone's time, money, or the patient's best interest, which is often treated as more of an optional extra. That's why you often see patients sent from pillar to post with issues that somebody could easily resolve with common sense and some balls. In the system, there is no prize for managing a patient quicker and better than predicted in the guideline. If anything goes wrong and gets investigated, a punishment in itself, the clinician will first be asked why they didn't adhere to the guidelines. Conversely, if the outcome is completely ridiculous, but the rules and guidelines were followed, it is not seen as an error. In the bureaucratic mind of the person investigating, the process is more important than the outcome. As an individual paramedic, your trust will not be your friend in this either. For the trust, a paramedic spending extra time undoing some bullshit and getting what the patient actually needs doesn't bring the trust any money or glory. From my experience at least, they would rather their staff shut up and do what they are told, and pointing out obvious absurdities is treated as a headache. As paramedics, we see countless patients mismanaged to the degree that makes some stories unbelievable. We will drive for 20 miles on blue lights at 3 a.m. to wonder with the patient why we are there to begin with, as everything started with the GP call about some medication problem 10 hours earlier. However, technically, everyone followed a guideline, so there was no issue. At this point, it is worthwhile to establish what an ambulance service is, or at least what it was initially intended for. It is a great tool designed for a specific type of event, which it excels at. If used for other reasons, it's not only ridiculously expensive, but also simply ineffective. An ambulance is probably the most resource-intensive way of delivering healthcare, after rescue boats and helicopters. The reason patients go to hospitals or clinics, rather than the other way around, is that the latter allows clinicians to see far more people in a day and have all the necessary equipment, such as CT scanners on site. This is by far the most cost-effective approach, as there are many more people in the population compared to the available resources. We expect that most people should be able to get to the GP, clinic, or the hospital themselves. If the person in question doesn't drive, there is an expectation that they will figure it out with family, friends, a bus, or a taxi. In the same way as we expect them to go to the dentist or a grocery store, for a small minority of people who, for reasons like severe disability or frailty, where no form of transport makes sense, to service them, we send a GP on a home visit or a district nurse to change dressings or do insulin injections. If the patient requires further care in a facility, there is some form of patient transport capable of giving a lift to someone who can't sit in a car seat. As you can see, an ambulance has not been mentioned yet. It's because all that is standard, normal, everyday, routine healthcare that has been in existence for decades. People getting sick at home is nothing new, and for most of the time, the system should be perfectly capable of dealing with it without any drama. There is an even smaller subset where something sudden, unexpected, and severe occurs, necessitating immediate intervention, often before transport. events that generally should not happen and are not part of routine healthcare. That's what ambulances were made for. Anaphylaxis needs adrenaline, catastrophic hemorrhage needs stopping, cardiac arrest needs ALS, and hypoglycemia needs glucose first, as these cases cannot just go to the hospital. That's why ambulances carry very specific drugs for very specific conditions and with very specific indications. It's because ambulances were never intended to deliver healthcare as a whole. At some point, some geniuses decided that it would be a great idea to utilize these ambulances that sit idle to do more. This, I think, is where the concept of urgent care must have come from. And this is probably where the downfall of the ambulance service began. Sounds good, right? Since emergencies are rare and other areas of the NHS are struggling, why don't we use ambulances to see patients on the more urgent side of things? The problem with so-called urgent care is that it can mean anything, and almost every condition can be exaggerated just enough to make it urgent. Also, from the patient's perspective, everything is urgent. This brings us to a broader and accelerating problem, other parts of the NHS. I am not talking only about HCP transports here, which can be insane in their own way. I'm referring mainly to 111 and GPs, who use the ambulance service as a same-day appointment with transport for people who are supposed to be under their care. A good portion of NHS services seem to have abandoned the idea of seeing anyone urgently. This is partly because they are already overwhelmed with their planned workload, and partly because sending patients to the ED by ambulance, if they can't get there themselves, is much easier. It is a win-win-win. No patient, no responsibility, and you appear to be helping. So much ambulance work now is dedicated to seeing someone else's patients, and none needs an ambulance. It is just that no one else will see them, at least not on the same day, and the person responsible doesn't want to get in trouble. Now, more and more, you can hear the patient saying, "I called my GP, and they told me to call you guys to see if I need X. If so, then call them, and the GP will arrange it." If that GP wants to be more covert about it, they can just escalate the potential diagnosis until it's not their problem anymore. After all, every infection could be sepsis, right? As much as it is fair to expect the general public to be reasonable and not abuse the ambulance service, it is not fair to expect them to be more reasonable than fellow NHS clinicians who advise them to call 999 for no reason. My biggest beef is not that everyone does it. It's that the ambulance service does precisely nothing about it. Worse, as I said in the intro, they may not even be aware that it exists. Another problem that the system is absolutely incapable of combating is regular callers. It is astonishing how much time, money, and other people suffering the ambulance service is willing to sacrifice to please the same person with the same bullshit problem for the third time that day, only because, just in case, you never know, this time they may be actually sick. There are multiple reasons why regular callers exist. Some are more legitimate than others. However, if someone has an ambulance regularly and often, regardless of the reason, they are either very ill or they are not, and call with bullshit. Either way, something like a regular caller should be very rare and treated very seriously. As of now, it's neither.